Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. So this is the third part of the ATLS Primary Survey. So let's quickly recap what we have done till now. So first we spoke about the full form of ATLS, that is the Advanced Trauma Life Support, and the parts being the primary survey, the secondary survey, and the definitive care. Next, we also spoke about the primary survey components. The primary survey components has A, B, C, D, and E. So A stands for the airway, and B stands for the breathing. We have discussed in detail. So B stands for the breathing. Then C stands for the circulation. Then comes D. So D was about the disability. Next, moving on, we had E. E was for the exposure. So disability and E for the exposure. This was the disability. So post this, we also discussed the adjuncts of the primary survey. So let's continue with that. So we have the adjuncts of the primary survey. So as we discussed, the first one was the blood collection. So in the blood collection, we look for the CBC. There is CBC, that is complete blood count. And then we also have the urea and the electrolytes. Next, moving on, we also have the clotting screen. So you do a clotting screen. Next, there is also the glucose, the toxicology, or the cross match. So you go for the glucose, the toxicology, or the cross match. Next, we move on to some other findings such as the ECG. You go for ECG, you can go for pulse oximetry, then ventilatory rate, capnography, just naming a few, capnography, or the ABG analysis. So these are the things which are done. Next, there is also the adjuncts of primary survey. There it includes the urinary and the gastric catheter. So there is urinary as well as the gastric catheters. Then moving on, there is also the radiographs of the chest and the pelvis. They are done as a part of the primary survey. So we have the radiographs. So these radiographs of the chest as well as the pelvis. So these radiographs of the chest and the pelvis are done as a part of the primary survey, and preferably with a portal X-ray unit. So it is done preferably with a portal X-ray unit. And when required, all these X-rays, they must be done on a pregnant woman. So even in a pregnancy, it can be done. It has to be done. Next, there is also a concept of EFAST, which also forms the adjunct of the primary survey. So next, what we need to know is there are some special modes of imaging. So what we call the special nodes, the special imaging. Those special imaging such as we talk about USG, that is the ultrasound, the computed tomography, as well as the angiography. So all this and the diagnostic peritoneal lavage, so they should be considered after the secondary survey. So all this are considered after the secondary survey, and only when the patient is stable after the initial resuscitation. Only after they are stable after the initial resuscitation. So it was USG, CT, angiography, as well as the diagnostic peritoneal lavage. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.